There's a mental health crisis, decades in the making, facing our children. This crisis has been heightened by the pandemic. Our children, our communities, and our future are at risk.
We do have a crisis on our hands, but the struggle has been not just against COVID. We've also seen amplified during this period of time children's mental and behavioral health needs. Having the capacity to recognize, prevent, and care for those needs, we believe, will better improve the opportunities and outcomes for our students.
Here at the University of Oregon, we dare to reimagine a new model to better serve the youth of Oregon and beyond.
We are aiming for nothing less than transformative change that we hope will eventually reach every child in Oregon.
Providing our state with a new level of behavioral health professionals and accelerating development of leading-edge interventions. This transformational effort provides a $100 million endowment for scholarships, aiming to infuse public schools with 200 graduates a year, diverse practitioners for diverse populations, ready to deliver science-based early detection, prevention, and treatment strategies directly into the lives of children and families. The Ballmer Institute for Children's Behavioral Health at the University of Oregon. It's a bold vision that signals it's time for us to act for the future of the state and the world.
Good afternoon, everyone, and thank you so much for being here today. My name is Richie Hunter, and I am the Vice President of University Communications for the University of Oregon. And what an exciting day, not only for the University of Oregon, not only for the children of Oregon, but the future of Oregon. And we thank you for being here today to find out more about the Ballmer Institute for Children's Behavioral Health at the University of Oregon. I'm going to be introducing a few people that are going to come up and share some background information on this exciting new institute, and then we'll open up for some questions. So I'm going to start with welcoming the president of the University of Oregon, Michael Schill.
Thank you, Richie, and again, thank you all for coming today. It's a really great day for the University of Oregon, but more importantly, a great day for the people of Oregon. And we are so excited to be part of this today. One of the challenges of a public research university is to show impact, to show how the work that we do affects people, improves the world. And no doubt, I have absolutely no doubt that this program, this Ballmer Institute for Children's Behavioral Health, is going to say loud and clear to the people of Oregon, this is why we invest in public higher education. This is why research and teaching and service go together. Kids in this state are suffering. Parents in this state are suffering. And our state needs help. In the University of Oregon, we are uniquely capable of providing that help. We have top flight research and teaching programs in our Department of Psychology and our College of Education. Top ranked programs full of people who both care and are experts in the field. And I am just so proud that our university can marshal that talent, can marshal the investments that the state has made in us and that philanthropists have made in us and do this program. I am so proud of our alumna, Connie Ballmer, and her husband, Steve Ballmer, who see the need, who lead in this area, who are deeply, deeply committed to child behavioral health. Connie and Steve are what I call transformational philanthropists. They're going to change the world. I already know they've changed the University of Oregon. Thank you all.
Thank you, President Schill. This institute would not be possible without partnerships. Partnerships are a cornerstone of us actually being able to change the future of our children. And I'd like to welcome to the stage the Superintendent of Portland Public Schools, Guadalupe Guerrero.
Good afternoon, everyone. I want to repeat the refrain. It truly is a good day for the children and the young adults of the state of Oregon. I just have immense appreciation to our president, to the Ballmers, to our partners, for a willingness to be bold, a willingness to be innovative, a willingness to see a problem and find a solution that really impacts the young people of our state. PPS, Portland Public Schools, is incredibly proud and excited about this new partnership with the University of Oregon. It's so critical to address both the observable and the growing needs for behavioral and mental wellness among our student population. While we've aimed as a school district to take a holistic approach in supporting our students' social emotional needs through a number of existing partnerships, we're excited moving forward to really extend the impact and the reach of our services for students and families starting in Portland through this unique partnership with the Ballmer Institute at a local campus in Portland that will support a few things, key things. The development of a diverse staffing pipeline in child behavioral health with both degree-seeking and certificate programs. A new behavioral health initiative that places an emphasis for us on our middle grades student experience, as well as supporting our underserved school communities, and professional learning opportunities available to all educators and support staff of the school district. Mental wellness is directly linked to student achievement and the healthy social emotional development of our students. Since the onset of the COVID-19 pandemic, we've witnessed the negative impacts that this pandemic has had on our students' sense of belonging, their emotional wellness, and performance in school. In particular, we've seen these impacts play out across our middle schools. With this partnership's focus on behavioral health, we will be able to bring new possibilities and outcomes with programs serving our schools across the Portland Public Schools, with the potential of an initial 7,300 middle schools, but potentially up to the 50,000 who are enrolled in our school district, and all of our surrounding local school systems. Another desired outcome of this partnership is to enhance engagement in families by providing training and understanding and support for the communities that we serve. We believe we can best ensure the wellness of children and young adults by partnering and informing families in the principles of social, emotional, behavioral, and mental health. Having the capacity to recognize, prevent, and care for those in need, we believe will improve the opportunities and the outcomes for our students and our communities, and ultimately our state. Thank you, everyone.
Thank you, Superintendent Guerrero. One thing I'd like to mention is that this is not our first work in the area of children's behavioral and mental health. Our academic enterprise is strong, and one of the reasons that Connie and Steve Ballmer have entrusted us with such this magnitude of a gift. So at this point, I'd like to introduce our Provost, Provost Patrick Phillips, who will speak a little bit more.
Thank you very much. This is truly a great day for the University of Oregon, and we're privileged to have many such great days. And I think that is an amazing feature of this university at this moment and moving forward. And as part of that, I believe that society continues to ask the question, what is the role of a public research university in the world today? And more, we believe that a critical part of that role is to understand and face and help address the critical needs that are emerging in the world. And I think that The behavioral health crisis is obviously one of those. And in fact, well into our planning, the Surgeon General came out in December 2021 and named the child behavioral health crisis as a national crisis that needs to be addressed. And I believe we'll actually be hearing more about that from President Biden later today. I think it's worth asking, as we have an announcement such as this, why us and why now? Why us as the University of Oregon? It's because we do have world-class research and faculty in this area that is recognized throughout the country. So this is the place where we can understand what evidence-based work can look like. We have a student body who we are very respectful of their own interests in getting jobs after they move through the university. But more than that, the students of the University of Oregon come to us asking, how can they make a difference? How can they help the world? And this is an opportunity to do that. This is also an opportunity for the state of Oregon to recognize what's special about it. We are at a scale, we have relationships, we are dedicated to co-creation with our community groups, with the public schools, and interactions with all of our state partners in the legislature and the governor's office to get this done. We exist at a scale where we can actually make a difference and be a little more nimble, a little more aggressive in what it is to address this crisis, and not get caught up in the normal kind of day-to-day challenges that can limit our ability to move forward. So what we're doing through the Ballmer Institute, it's really the first step in creating a whole new model in how we're going to address behavioral health in our schools and in the world in general. We're creating a brand new workforce of diverse practitioners for diverse populations. And we're going to be centering that in the needs of the populations that we serve. We're not coming in as a university and saying, this is what we think you should do. We're going to work with everyone to understand what the challenge needs to be addressed. So we'll be training countless numbers of graduates, and they're going to move right into the K through 12 schools. And these are youth who are in desperate need of behavioral and mental health care. So these graduates, which we'll be very proud of in the next coming years, are going to provide a new level of care that simply doesn't exist now, and it's going to hopefully serve our part in addressing what is a complex problem, but it's a complex problem that will take many, many partners to address. Thank you very much.
Thank you, Provost Phillips. The power of philanthropy. Without philanthropy, we would not be here today. Without philanthropy, universities would have much more of a struggle impacting society in an accelerated pace through our research. And at this point, I'd like to introduce Vice President Michael Andreasen, who's our Vice President of Advancement, to come and share a few words.
Good afternoon, everyone. I'd like to add my thanks to the Ballmers for such an extraordinary gift. $425 million. It's takes your breath away. Connie and Steve were really true partners throughout the entire discussion, really with our faculty colleagues, which are sitting here before me, and how to establish something different and unique in the Ballmer Institute. And I dare say the one thing that they kept asking us is, how will you know you've made a difference? That is really what has motivated them to make such an extraordinary gift. What's so special about this gift is that the University of Oregon will work in partnership with the state, with our schools and communities, to really make a difference. It's a bold and audacious idea, bringing the world-class research and the new innovative teaching and direct interventions in the lives of students every day. One thing I want to draw attention to, a major part of this gift is the establishment of a $100 million scholarship fund to recruit the next generation of students who wish to enter the behavioral and mental health field. I'm increasingly convinced that donors, like the Ballmers, are asking of us, maybe even demanding of us, to leverage our core mission of teaching and research in a more immediate and direct impact on society. They're asking us to tackle the grand challenges. The Ballmer Institute for Children's Behavioral Health does just that. Today we celebrate a truly transformational gift. This gift comes along with the generosity of Phil and Penny Knight, who are standing on the shoulders of generous, loyal ducks around the world. Our most recent campaign, which ended in June of 2021, saw 147,000 donors make over 500,000 gifts, totaling $3.2 billion over the last decade. This unprecedented philanthropic support in the state of Oregon will have a lasting impact on our students, on our faculty, and our campus community for generations to come. We couldn't be more grateful for their trust and their confidence in us. And we stand committed to honoring their generosity by making a positive impact on our community, our state, and our world. Thanks.
Thank you, Vice President Andreasen. So before we get started with media questions, I want to introduce our subject matter experts, and they're seated here in the panel before me. First, we have Dr. Randy Kamphaus, and Dr. Kamphaus is the Executive Director of the Ballmer Institute. He is an elected fellow of the American Psychological Association and an accomplished author whose research program has been devoted to clinical test development, behavioral health assessment, and diagnostic practice, primarily in the Americas and Spain. To the left, we have Dr. Laura Lee McIntyre. Dr. McIntyre is now the interim dean of the College of Education and is a Castle McIntosh Knight Professor. She's a professor and co-director of the School of Psychology program in the Department of Special Education and Clinical Sciences. She is also the director of the Prevention Science Institute, where she investigates mental health, children and families, special education, and prevention and intervention to promote child and family well-being in vulnerable and underserved populations. We also have to my right, Dr. Jennifer PFEIFER. Dr. PFEIFER is a professor of developmental science in the psychology department at the University of Oregon. She's also the co-director of the Center for Translational Neuroscience, a fellow of the Association of Psychological Science, and co-director of the National Scientific Council on Adolescence. Dr. PFEIFER studies social and biological development across adolescence and how these changes are intertwined with youth mental health, behavior, and well-being, especially during major transitions, such as into middle school or out of high school, or even as we move through and out of a pandemic. I'd like to welcome the media to ask questions, and if you have a specific question for a specific individual, please make that known, and our panelists, our experts are available to answer. Thank you.
I'll be happy to address that if you don't mind.
Thank you.
Thanks for the question. Yes, I have to say we feel the same urgency as the rest of America. So we're now, I think, accelerating our work significantly. Our faculty are fully engaged, and we're in conversations now to start a workshop program this summer with Portland Public Schools, just so that we can serve schools as quickly as possible. Late this year, we anticipate opening our certificate program. That will probably be 3 to 5 courses in length over the course of the academic year. And then that will be followed by our entering class of 200 students in fall 2023. So that'll be the initiation of the bachelor's level program, 200 students per year. Thank you.
Yes.
Hi, I'm Duncan Baumgartner. I'm with the Emerald, and reading the statement that was released regarding the new program, there was a reference to how Portland is at the epicenter of the behavioral health crisis, and I suppose I'd put that to Superintendent Guerrero. Could you speak a little bit more about that?
Well, I would say the entire American public school system is probably experiencing and feeling that they're at the epicenter, but certainly as the state of Oregon's largest school district, we see it within our school communities, these readiness to learn challenges. As you know, it's the largest metro region. I speak regularly with my colleagues across the state, other superintendents. They're seeing and observing what I'm observing, that we have students who are facing many challenges returning from this pandemic to our classrooms, the stressors, the anxieties from the young children to our high school students, and educators and support staff that really want to understand how to best meet those needs. You combine that with the everyday realities I have to wake up to thinking about how to best address that are not just about the emotional and behavioral health, but also the rampant gun violence, the houselessness, the economic insecurities. We are witnessing all of those factors, even as we try to teach reading and math and all of the other academics. So it certainly feels like we are at the epicenter, and certainly, you know, these same traits are evident in a lot of our cities and towns.
Yes.
Yeah, I was wondering if you could tell me about how the Prevention Science Institute fits into all this.
I'd be happy to talk about that. As the director of the Prevention Science Institute, the field of prevention science really focuses on preventing behavioral health and other problems in the community by looking at ways to detect things early, to develop interventions that can support optimal development and growth and healthy outcomes. And we do this in sort of a multidisciplinary field of prevention science. I'm a special educator and a psychologist. We work with neuroscientists, we work with developmental science, we work with practitioners to detect and prevent and intervene early. And we can use this model or this framework to address a number of different problems that affect society. Here, the focus, and prevention science is really baked into the DNA of the Ballmer Institute. The focus is on children's behavioral health.
Yes.
Dr. PFEIFER, I was hoping you could address the impacts that behavioral and mental health have on adolescents and older kids. How does that tie into this new institute?
Yeah, thanks for that question. So we know that adolescence, even before the pandemic, is the period of the lifespan where you see the greatest risk for onset of mental and behavioral health disorders, for most mental health disorders. In the state of Oregon, just in the last year alone, nearly 1 in 5 youth aged 12 to 17 experienced a major depressive episode. And so what we know is that over half of youth in Oregon who need services, mental and behavioral health services, are not getting the care they need. And Laura Lee talked about the importance of prevention and early detection, and that's essential. But also, these problems, they are going to emerge. You heard Guadalupe talk about middle schools. And while prevention is essential, late childhood and adolescence is not too late to intervene. And so, in fact, we know that economic analyses show that return on investments in late childhood and through middle adolescence are some of the best you can make in the future of our communities.
Another question?
Yes.
So obviously this is a major issue to tackle, and so I'm wondering if you can give some context to where you began with this first group of, this first cohort, if you will. What kind of courses are they going to be taking, with a little bit more specificity beyond just, of course, the intervention and prevention.
I'll be happy to give that a try. Thanks for your question. Yeah. We're still in the program planning stage. we'll be mapping out a curriculum with my colleagues here at the table and other faculty members between now and November. Then it will go before the university for approval and the Higher Education Coordinating Commission for approval before launch. Our early discussions have a distinct focus on promotion and prevention in addition to care, because we, as Dr. Pfeiffer mentioned, we have children who need care for mental health disorders and they're not getting that. In addition to that, however, there are children with risk who are not engaged in prevention practices either. So my hope is that we'll continue to have discussions around designing this program to serve the full continuum of children. Everyone with basic prevention and health promotion practices, children with a little bit of risk, and the children with significant need that need state-of-the-art science-based interventions.
Yes. Hi, Kirsten Lindquist, KDON, KMTR. I know Superintendent Guerrero outlined some of those urban challenges that Portland faces, and we are starting with Portland first. But how will this program be adaptable for those who maybe want to work in more rural environments across the state of Oregon?
Happy. I'll be happy. We'll all three answer that one. How's that? I'm going to speak about your department. So our psychology department is doing some extraordinary work in digital healthcare delivery, and I'm really excited about that. And that's going to be an important, I think, value add to our curriculum, is to be able to create interventions that are easily delivered at distances and delivered quite effectively. I hope I didn't steal your comments, but and feel free to flesh out that thought further. But there are a variety of means that we're considering to deploy ourselves throughout the state.
I would also add that one of the reasons why we're focusing on the certificate program first and then rolling out the undergraduate degree once we go through the curricular approvals and so on, is that we want to reach professionals who are working with children right now. And that means right now where they're at. Some will be in Portland, some will be in other parts of the state. And the focus on deploying these supports to professionals through our certificate program really enables those professionals that are serving children and youth in their context, be it in schools or other contexts, to kind of take that and tailor it to their environment. The issues in urban schools are different than the issues in rural schools. We sort of deal with that in Lane County. There's a great diversity of our schools here. And so it's important to kind of have a multi-level deployment strategy so that we can really be more nuanced and thoughtful about how we work with those professionals in their contexts.
I'm wondering what plan, if any, is there to incentivize graduates of this program to remain in Oregon and dedicate the service to our students here? Are these partnerships that we've talked about going to provide that opportunity for them to have local
jobs? It's part of the rationale for moving into the most densely populated area of the state and the most demographically diverse area of the state as well. So that gives us an opportunity to, we hope, actually provide greater economic opportunities for the citizens of the Portland area who can upgrade their licensure, their credentials, and take these new careers. And if they're of the community, we think there's much greater likelihood that they will return to the community. So that's part of what our provost was talking about co-creation and early fruitful partnerships. In addition to that, as Mike Andreasen mentioned, a good portion of that $100 million in scholarship funding is dedicated to full rides for Oregonians. And again, by selecting individuals of the communities that we serve for this program, we think we have a better chance of them returning.
Can I just add to that answer? Sorry, I'm a little slow on the trigger here. I just wanted to add a couple of things. I think if you look at the press materials, you'll see that Governor Brown speaks to the fact that the state is actually allocating a lot of resource here, and we expect that to continue through the state and the federal government. And so part of the partnership is how can school districts best deploy those resources that are forthcoming. Again, this is not the typical Oregon story where we're kind of under-resourced. It's a question of how do we actually deploy the resources that we have the best way. And just to add on to what Dr. Kamphaus said in terms of the local environments, I think there's also a lot of opportunity to partner with community colleges and other streams of student input as well. And we find that those students tend to be frequently very grounded in the location that they're coming from. And so doing this through Portland provides an opportunity, although, as you've already heard, this is just the beginning. And I would say that the Bombers really emphasize this as well. We want a statewide impact, and we will seek, as we grow, all these means, digital, visiting opportunities. We will be producing a lot of students, and hopefully they'll want to be throughout the state.
Thanks, Provost Short. Second, Provost Phillips, excuse me, second row.
Laura Lee, maybe this is a question for you then, and it ties back in what the others have said. How big of a barrier has there been for new students who are interested in the field to come? That $100 million endowment seems just amazing amount of money, a great opportunity creator.
Yeah, it's an incredible opportunity to recruit new students to come to the University of Oregon. And actually, you know, when you think about our youth in high school right now, they're living through a pandemic. Their whole high school careers have been marked by, I mean, we all have been affected by the pandemic. And many of our entering students who've graduated and are looking for college want to make a difference in the world. They want to do something impactful. They know that their lives have been altered forever, and their parents and their community members, brothers and sisters. It'll be huge, not only as a recruitment strategy, but to offer a brand new, novel behavioral health undergraduate program. It's gonna be game changing, and I think taps into the motivation of a lot of our youth today who want to do something significant and make that impact.
Yes, front row.
So I was curious about like what would be the requirements for those students that want to get that scholarship to make an impact in the education department. Like what would be will be any requirements like strict restrictions or not? Not for international students.
Now, we'll still have to work out the framework for awarding those scholarships, but at this point, there is a priority to support Oregonians, but we will. And as the provost was mentioning, we expect the scholarship opportunities to expand significantly because this is such a high priority for our society right now that I fully anticipate there will be additional scholarship opportunities coming forward of great variety to support these undergraduates.
Are there any other questions? Okay, thank you all for attending this press conference. We appreciate it greatly. We look forward to sharing more information as we continue towards the launch. Please visit Children's Behavioral Institute.uoregon. Children's Behavioral Health.uoregon.edu for more information as well as media assets. Thank you.